Hi, welcome to the Fit and Healthy Today show. And today our topic is going to be headaches. Now I'm just going to primarily focus on headaches and not migraines. Headaches are caused by various different reasons, and the multitude, there's much more probably than what I even have written on here. But what they basically are is irregular attacks of pain in various parts of the head or the sinus cavities. And probably the most common ones are going to be due to tension and stress or allergy or sinus issues. When we look at causes, they're numerous. So sometimes it's very difficult for a physician to diagnose where to go from on here. So I'm going to give you some of the causes, and then for you to kind of attach what you normally feel based upon the causes are going to be what your treatment is going to be. So it's a little bit complex, but getting bottom line to the cause is always the best way to do it. Probably one of the most common is going to be a cervical or spinal, and you have to pardon me, my spelling for some reason, I have like 4 or 5 spelling mistakes. But spinal or cervical, that will be right up here in the upper part where you'll be misaligned or out of adjustment or have a degenerating disc. You'll find that you'll get headaches that'll shoot and be all in the back of the skull. And oftentimes those can become chronic. A good chiropractor can also help with that in getting the circulation flowing better into the spine, and then some of the supplements we're going to talk about later on as far as maintaining your circulatory. Muscle spasms in the base of the skull, neck, and shoulder tension, especially for people who are leaning over in their job all the time, writing or typing or that type of thing, or if they hold a lot of shoulder stress. That'll lend itself to a lot of headaches that come from the base of the skull, the neck, and up right to the back of the head. Stress. Oh man, stress headaches can emulate anywhere in the head, but oftentimes we'll notice we'll start rubbing right here when we get a lot of stress and tension. You'll see people kind of go like this or like this. Stress causes certain changes in our body that induce headache formation. Blood sugars. Oh man, if I watch my blood sugars drop, I'm hypoglycemic, that can trigger a headache overall in me and make me kind of off balance and all. I experienced that a little bit today. And so therefore, necessary to probably eat 4 to 5 consistent smaller meals per day if you have blood sugar issues, keeping the sugars at a more normal basis. Hormones, particularly with women who have PMS or PMS times, or during perimenopausal or menopause. The increase of estrogens and the decrease of progesterones can trigger headaches, or just the various imbalances of the hormones and thyroid hormones as well too. Sleep, that's a big one, considering the majority of working women and most of the men are not getting enough sleep. That can make you off balance, kind of make you almost numb and almost in a drunken state, and can trigger headaches. Digestive problems. So, you don't think of your digestive system as contributing to headaches, but when your body's holding on to a lot of toxins or you're not having adequate bowel movements, those toxins flow back to the body, into the head. Oh yeah, that can actually cause chronic headaches. Diseases of the eye, ear, nose, and throat, sinuses, and teeth. I had a customer recently, we couldn't figure out why she was having a chronic ear and sinuses. She wasn't having any green coming from the nasal passage. It just didn't look like an infection, but lo and behold, she had a tooth in which a cap was coming loose, and she didn't experience any pain, but there was an infection going up inside. So your teeth can affect all those areas as well. Sometimes what appears to be one area causing you pain is something else causing it. Medications or drugs. There's certain medications that can contribute, certain high blood pressure medications, painkillers, lots of meds. I could go on with the list that can trigger headaches. As a matter of fact, what I find is almost half of the medications out there have a potential side effect of having headaches. Chemical or foods or additives like MSG, sulfites that you're going to find in like processed meats like hot dogs, lunch meat, and fermented foods. Chemical reactions, I know for me, if I get something with MSG, it'll send me in an instant headache, just right about here. And I had that actually experienced that just a teeny bit last night after I had a burger from a local establishment. Boom, I had just a slight bit of a headache and then ended up with a little bit of an allergy from it too. But it triggered from whatever additives were added maybe in the sauces or the ketchup or MSG, which I'm real sensitive to. So you have to be mindful when you look at packaging and you see sulfites in MSG and you're sensitive to it. It's also found in wine and some of our alcoholic beverages as well too. That can trigger headaches. Alcohol can trigger headaches, obviously, because it's a vasorelaxer, but then you can get vasoconstriction. So it's that back and forth motion that can trigger headaches, and then it also messes with blood sugars as well. Tyramine-rich foods, oh God, there's a lot of them. Peanuts, certain coffee, chocolate, those types of foods can trigger headaches. So if you're sensitive to tyramine, you have to avoid them. Coffee. Now it's interesting because coffee is oftentimes considered a cure for headaches because it causes vasoconstriction. The problem is as soon as the caffeine wears off, boom, you have instant vasodilation and it can set the body off. And if anybody's ever tried to get off coffee or taper off, oh man, oftentimes in the morning you'll wake up with a headache. So any type of narcotic, caffeine, any of those types of cigarettes that we see, nicotine, all of those types of narcotic types of drugs can trigger that. Anemia and B vitamin deficiencies can trigger it because obviously if you don't have enough blood to carry your iron and the oxygen circulating, that can trigger headaches. Dehydration and electrolytes. This is very common among athletes. They'll think they're fine and then all of a sudden they end up with blaring headache. Now, there is an interesting issue that I experienced with a client, a customer of mine that was a client of one of our trainers. The lady would start exercise and immediately she would get a headache. Now, I shipped her off to the doc because the concern is when you get headaches right at the start of exercise, it can mean that we've got a little bit of heart issues going on. You're not circulating your blood very well. And immediately when you're starting to exercise, even though the blood pressure shows normal, it can mean that you've got circulatory issues. So I shoved her off to the doc. So before you exercise, always try and get some clearance from your doc or have a doc aware of what you're doing because this can trigger and it can be dangerous. Obviously, if you have severe headaches that don't go away and they're chronic, you need to go into your doc because it can be tumors, it can be medication issues, it can be lots and lots of things. So if it's a chronic issue, you need to go into your doc or your healthcare practitioner if you have a naturopathic doctor and try and determine what potentially could be the continual cause of headaches. As far as diet is concerned, I've listed here some of the tyramine foods: wine, cheese, citrus, chocolate, coffee, soda, and the caffeine-rich foods. You're going to want to avoid these, obviously, because they cause an extreme fluctuation. I can go into the norepinephrine and all that kind of discussion as far as the issues with tyramine and caffeine-rich foods, but I'm not going to do that. The key is they trigger circulatory constriction, dilation, which can in turn trigger headaches. What you want to do if you have a chronic headache issue is you always want to keep your blood sugar stable. So what that means is you want to have a meal or small meals throughout the day, and this is great for weight loss as well too, that are protein, have a little bit of fats and a little bit of carbs and fibers. So those balance of 4 things will keep your sugars more stable, give you energy and fuel for the brain, and you're going to feel awake, have more energy, and you're going to be much less likely to see the fluctuations in that dilation and constriction of the blood vessels based upon blood sugars and other chemical reactions. Chewing gum. People who are chronic gum chewers oftentimes end up with more headaches. Now that could be issues with TMJ and other issues, but that continual oxygen, that weird oxygen exchange when you're chewing gum can actually leave you oxygen deprived. So if you've got those gum chewers all the time, it can actually deprive you of oxygen. So be aware, that's probably not a good idea if you suffer from chronic headaches. Iced beverages, because when you drink iced things, you know, anytime you're talking about ice, you could get a vasoconstriction immediately, and then you're going to go back and forth with the dilation and constriction. So avoid iced beverages if you tend to have headaches. And then obviously we mentioned the foods with the chemicals. Avoid them. You know, whenever you can shop natural or make your own things from scratch or get organic, please, by all means do, because you're not going to be dealing with the question of whether or not chemicals could be causing your headaches. When we're talking about headaches, especially stress headaches, and particularly this time of the year when we're talking about holidays, at least 30 minutes a day of exercise is really going to increase the circulation, help get rid of the stress hormones, and relax a lot of your muscles. You're going to get a good circulation, vasoconstriction and dilation. You're going to get that flexibility of the vascular system that's so necessary. So please, particularly during stressful times, try and get that little bit of exercise, even if it's just walking the dog at a brisk walk every day. Very helpful. Now, when we're talking about supplements, man, these vary depending on the type of headache that you have. So I've written some down on here that I know for basic headaches that can be very helpful, but there are specific types of supplements that can help with specific types of headaches, and I'll tell you, in the books I had, I think I counted 40 different types of headaches that people suffer, and each of them has a slightly different treatment. So these are just some things that you can do to kind of hedge your bet and keep headaches away. A good multiple high in Bs. Or in addition, a B complex added into that. That can also be helpful for migraine headaches, but that helps you deal with physiological stress. So if you have a stressful job, or you have stress because you exercise a lot, or stress because of emotional issues, or whatever it is, or that you're not getting enough sleep, a good multiple that's got a lot of extra Bs will help you physiologically deal with stress. Calcium, magnesium. Now, I like a balance of that, and particularly the citrate forms, because magnesium and calcium work together for constriction and relaxation, and you won't see such extremes. Oftentimes when people are magnesium deficient, they'll only get vasoconstriction and they'll have continual headaches, or if they don't have enough calcium, they can get too much vasodilation. So a nice balance of calcium and magnesium can be very helpful for prevention of headaches. Cluster headaches, and there's a lot of studies. Those are people, where it's all over the brain, and sometimes these are even measurable by the docs when they do scans. There were some good studies on L-tyrosine, L-glutamine, and quercetin combinations of 500 milligrams each to help with cluster headaches. Vitamin E. Remember how we talked about the gum chewers and the poor circulation? Well, remember, the brain requires oxygen. So if you're a cigarette smoker or anything in which you feel your body is lacking oxygen, and that'll oftentimes show up in blood work that your doctor will do. It'll say your CO2 and then your O2 oxygen levels. You can kind of know whether or not your body is carrying oxygen very well. Vitamin E slightly thins the blood, and it also helps with oxygenation. We oftentimes use it in COPD to help with oxygenation. Borageryl progesterone cream. To get specific on the dosages depends on the person, but for women who are estrogen dominant and progesterone deficient, or who have extreme fluctuations in hormones, they will find that trigger of headaches, particularly around just before their period during times of PMS, but when you're perimenopause, you can experience it all the time, which makes it hell for everybody around you. So there are some ways that we can help balance out some of those hormones. Ginger and cayenne. Cayenne, as long as you don't have arthritis. Ginger and cayenne are hot herbs, and along with turmeric, that are very good for the circulation. They get things moving and rolling, and oftentimes we'll use that in Raynaud's syndrome. Those are people who you oftentimes will see blue fingers and toes. That can help with circulation. Vinpocetine increases cerebral flow for oxygen to the brain. It comes from extracts of periwinkle, which can be very helpful in like a 5 milligram dosage a couple times a day. That can help. Thins the blood though, so you have to watch it if you're on aspirin therapy. There are tons of homeopathic remedies out there. I know I brought a sample of one in, and I'll show you when I'm going to demonstrate some